In today's broadcast, we've got a review of the Biden budget proposal and how it affects health insurance not only for you today, but how it can affect your retirement plans in the future. Basically, I'd call the Biden proposal by the following words: go big or go home. Welcome to the Much More Than Medicare broadcast. My name is J.O. I'm the author of Maximize Your Medicare. I also run GH2 Benefits, which is a financial planning and insurance brokerage firm. Before we get started, I want to point out this particular statistic, which I found at Kaiser Health News. To give you an idea, this is probably the very top end of those types of providers that provide information, insight, analysis on health insurance, health care. I'd probably call it as unbiased as it possibly can get. Big shout out to them. I pretty much look at it every day or multiple times a week. Anyway, this graphic that's showing up here on your screen here is highly disturbing. And it's part of the reason that I'm starting out today's broadcast here, which is that too many people do not understand the way that the American Rescue Plan, ARP, works. You can look at the videos on this channel. Much of the last 2 months have been around the word called Biden Care, commercials, etc. Ongoing drumbeat from me. There's a reason for that, which is that health insurance costs for those people who qualify is a dramatic increase in financial quality of life. The premiums down 80%, even 100% depending on your age and situation. The people who need this the most are those who are underinsured or uninsured. But the thing is that it's not only for the uninsured. If you currently have health insurance, you can also switch plans and get a better subsidy, which is a tax credit. There are subtleties around this, lots of other sound bites. In addition to that, you can also stay with the same plan and possibly get an increased subsidy. All of this is entirely possible under the idea that you know, number one, that you understand that this is available, and number two, that you actually complete it correctly. On this channel, I've been able to give you the 5,000-foot view on these 2 points. The reality is that I don't recommend people try to do this by themselves. You can see when I created videos that say errors, investment error, investment planning errors, etc., etc. The reason is due to my age-old analogy called the silo effect. Meaning is that the increased subsidies, these subsidies are tax credits. That means that anything affecting your taxable income will be possibly affect the amount of health insurance subsidy. So what ends up happening is you cannot look at these as two isolated topics. They are now all interrelated. Something that I've known, something that I take a great deal of time on when discussing Maximize Your Medicare, when I'm making, quotes in the national media. So again, the main thing here is that these subsidies exist. It is disheartening to me that not everyone is taking advantage of it. And they're not all going to come to me. I'm under no illusion, right? Not every underinsured person is going to come to me. That said, I'm asking you here on this channel to please share, like, hit the notification bell. Because what you can do is increase the amount of awareness of these types of features to others. And that will help the system as a whole, including yourself. This is the thing that people may not completely understand. When someone is underinsured or uninsured, they leave a financial problem somewhere. They leave it at the provider. Either number one, they skip care. You will know somebody. I don't want to go to the doctor because I don't want to have to pay the copay and I don't have insurance. Or they skip on the medications. The second one is that some people go to the doctor because they must, and they leave an unpaid medical bill. The doctor, the hospital has to use money in order to create those services. Who ends up paying a higher price to health care, right? You've got, every business works this same way. A 7-Eleven, right? If they're shoplifting, for example, right? They may have to raise their price if it's rampant, right? In order to recoup the losses. Well, who creates the losses? The uninsured. Who ultimately pays? The insured. So the reality is the ripple effect of you sharing, like, subscribe, hit the notification bell, the ripple effect is actually you. Please. President Biden released his budget proposal last Friday. I've had a few days to digest. When it comes to health insurance and health care, I could basically describe the Biden proposal as go big or go home. It's a laundry list. It's a laundry list of, kind of like Santa's list. I hope for all of these different items. And certainly this can be seen as that. It's not really a very specific set of proposals. I mean, it is a set of specific proposals, I should say. But what I'm saying is that it looks like a catch-all, a wish list. How many of them can be actually implemented into legislation? That I will not settle here because of the fact that I'm not a budgetary person. I'm not a person who is like a congressional tea leaf reader. Nevertheless, I thought to go through some of the biggest components and describe exactly how these could possibly affect you, because some of them are literally transformational. It can change the trajectory of financial planning and retirement planning. When it comes to Medicare, the Biden proposal does address a couple of items. First, and most notably, it is suggesting that Medicare eligibility go from 65 to 60. Now, for me, this is very important because of the many, many ripple effects. That's about 24.5 million, apparently, would be instantly eligible for Medicare. So the fact of the matter is the real issues, there's a lot of issues, but let's just highlight kind of the most important in my view. The first is the language of Medicare is not precisely the same as health insurance prior to Medicare. People who are new to Medicare know this to some degree, right? The book, Maximize Your Medicare, is there to describe all these differences because you're going to have to get used to a new language. Even when the terminology may look the same, it doesn't necessarily work the same. Because of that, you've got 24.5 million who would all of a sudden need to become educated on Medicare. The second thing, though, and kind of the more subtle and far more specialized issue, is the fact that the entire trajectory for retirement planning would change, right? Because you can know somebody, that may be you yourself. You're 62 and you have a 67-year-old spouse who continues on their job in order to provide health insurance coverage under benefits package for the 62-year-old spouse. This is a very, very common situation. Now, all of a sudden, as a result of the much larger tax credits for individual health insurance, it's entirely possible that the 62-year-old could be covered either from the higher subsidies, which does exist today, but then even more dramatically, that 62-year-old could be eligible for Medicare if the eligibility age was dropped to 60. For this, I'm going to be having on GH2 Unfiltered, which is the subscription site, a large number of specialized videos to be talking about these points specifically. It's just a singular example of all of the ripple effects that is going to affect more than 24.5 million people, because it also includes those households where one of the spouses is working beyond the age of 65. That entire thing can be reconsidered. Further, someone in their early 50s, mid 50s, can now recalibrate, reconsider what they mean as far as early retirement timing goes. Many people in their mid to late 50s are thinking to themselves, okay, I'm going to work until 65 as a result of Medicare eligibility, because they know that healthcare cost planning is a huge expense and a huge possibility for future expenses. However, a lot of that can be addressed if that person becomes immediately Medicare eligible at the age of 60. Now, the amount of time you need to consider without health insurance, or thinking that you need to consider health insurance between, let's just call it the age of 58 and 60, is now a much shorter window than from 58 to 65. You can see my point, how complicated it'll be. It's going to be far more complicated than that. GH2 Unfiltered is a good place. I'll send you Maximize Your Medicare for free, postage in the 48 states free. In addition to the lowering of the Medicare eligibility age, there are a couple other components to Medicare. The largest of those, the most significant of those, is that prescription drug coverage, prescription drug pricing will be negotiated by Medicare separately. Currently, that is not the case. Currently, the way it works is that every plan negotiates every price on every medication, and that also changes based on where you actually receive, the retailer, whether it be mail order or your local pharmacy or the national pharmacy chain. This moving combination, right, is very, very confusing. Made more confusing by the fact that since it has to be done on an individual basis, we've got no baseline. The Biden proposal is to suggest that Medicare will do the first set of negotiations. There will still be nuances, I suspect. But nevertheless, this is a very, very different framework. The third largest component is that dental, vision, hearing coverage would be included inside of Medicare. Now, this yet to be seen, because we don't really have a good setup right now. We have nothing that we can just simply attach, flip a switch and be able to say, okay, here's how it's going to work. There are going to be ripple effects here, because of the fact of the matter is that dental, vision, hearing, for a generic case, for example, like myself, right? I need eyeglasses, but that's just a genetic matter, right? So I wouldn't be covered if I were a Medicare person. However, if I had glaucoma, it would be. So now you're going to have to see what the providers and how all this would fit together. That, I think, is still yet to be seen. Nevertheless, three pretty big things, which is Medicare eligibility age, the largest, prescription drug coverage negotiation directly with Medicare, and then third, dental, vision, and hearing. Three pretty large changes to Medicare, which is reason to hang on to the channel. I mean, I keep saying this, which is that we're going to have changes to the system, plans, policies, the way they fit, and then the financial results are going to be different as a result. More reasons to hit the like and subscribe button. When it comes to individual health insurance, again, some fairly notable changes or proposals in the Biden budget. First of all, The subsidies, the advanced premium tax credits, which have been greatly enhanced as a result of the American Rescue Plan, which I've called Biden Care, this is looking to be put into place permanently. So again, the tough thing about YouTube, the tough thing about these videos, and why I try to encourage you to like and subscribe and keep up to date and watch, is that a single statement that I make in one of the videos can totally change your trajectory. It can totally transform that trajectory, meaning that your decision would be different. The financial impact in the thousands of dollars a year running, literally. But, of course, I'm not there sitting with you in front of your phone, in front of your TV, wherever you're watching this, right? And so I can't quite give you the specific private advice to capture this money, whether or not this situation affects you personally. I can speak it in general terms. For that, there's GH2 Unfiltered, there's, emails and all that kind of stuff where you can reach out privately. And of course, your first call is always free, but onto the larger population. The larger population, this is going to be pretty important, right? Because as a result, let's say you're 61. Well, now all of a sudden, originally the American Rescue Plan was supposed to end at the end of 2022, at the end of next year. If you make it permanent, that can get you to Medicare eligibility, where your premiums are lower, your coverage is superior. So the first thing is the permanence. Much larger in the backdrop, and one that I suspect was thrown in on this laundry list, the Santa's wish list, is something called the public option. Now, you might recall, for longtime followers of this channel and longtime followers of me and GH2 Benefits, is I spent a fair amount of time in the national media on talk radio, 20, 30 stations or so, during the time that the Democratic nomination process was occurring. And during that period, healthcare proposals were flying around left, right, and center. Medicare for all, rest in peace. But then also was this idea of public option. Here's a copy of the video that, the thumbnail to the video where I discussed that at some length. Basically, the short version is a public option is a federally sponsored health insurance plan for everyone. So that if you could not buy a private insurance plan, or if you found it unaffordable, that you could use the public option. Now, I think that this is a lot more difficult to implement, because in addition to the obvious budgetary political football that we're about to begin, right? That contest is not yet really started. But in addition to that, we're not exactly sure how you would actually execute it. Now, I have ideas, okay, of course. In fact, I had a whole separate podcast, which you can listen to on Spotify, Apple Podcasts, wherever you get podcasts, which was audio only, where I would discuss, possible ways that you actually put that into place. However, to click your heels or to snap your fingers and to implement it is going to be a little bit more daunting, much less whether or not we're going to be able to pass that type of legislation through Congress. Nevertheless, those are the two big ones, I would say, which is, again, you would make these APTCs permanent, and also you could have the possibility of a public option. Those are yet to be seen.